Now, from South Sudan to something human, staff members in both public and private sectors should be involved in the fight against HIV and AIDS. This will be an important stride in breaking the cycle of the killer disease in the country. Further, it will ensure productivity in organizations, thus leading to economic growth. The following report has more.
Human resource is the most important factor of production in any organization. In fact, the success or failure of any organization depends largely on the human resource. There is therefore the need to examine issues that affect it. One of the issues identified as a major threat in many workplaces is the HIV virus. It affects the most productive segment of the labor force.
HIV is still a national disaster, something that we cannot wish away, something that we need to do something about. And one of the first steps of any institution beginning to work on or joining the response in HIV is by first recognizing that it is a workplace issue.
Further, there has been loss of time due to prolonged illnesses, absenteeism, reduced performance, increased stress, stigma, and loss of institutional memories, amongst many others. Consequently, businesses and organizations suffer economic loss due to decreased productivity and increase in healthcare costs.
The reason that people can die of HIV today is because of stigma. We are stigmatizing people who have HIV to the extent that they fear to go for services. They fear that if they disclose their status, they'll be fired, or they will be posted to places, or they'll be treated differently, when in fact they can live healthy lives, and you and I would never have to know that they are actually HIV positive.
It is estimated that more than 2 million people are infected with the HIV virus in Kenya, while 1.5 million people have already died from the virus. As a result of the negative impact of HIV in the workplaces, institutions have been urged to come up with policy frameworks for the prevention, treatment, care, and support of the infected and affected workers.
The policy also defines the position and practices within the multi-sectoral response to HIV/AIDS pandemic. In addition, it provides guidance for those who deal with the day-to-day HIV/AIDS-related issues and problems that arise within the workplace and outside employees' rights, responsibility, and expected behavior in the workplace.
There is therefore a need to develop a clear, consistent, coherent, and harmonized policy framework on HIV for all organizations. These policies will provide consistency in organizations' dealings with employees through programs, procedures, and rules that flow from the policies.